Demonstration 1. Infant CPR. The deterioration of this infant has been anticipated. Therefore, the appropriate aerosol generating procedure, PPE, has already been donned. Gloves, gown, eye protection, FFP3 mask. Always make sure it's safe to approach. Check for danger. Look for obvious hazards.
Baby.
Gently
Hello.
stimulate the
Hello.
infant and check for a response.
Hello. Hello.
If the infant does not respond, shout for help and pull the emergency bell if one is available. Open the airway. Make sure the infant's airway is clear. Check for any obvious obstruction. Place the head in the neutral position. Look for absence of normal breathing. Take no longer than 10 seconds. Do not put your face near the infant's face to listen and feel for breath. In hospital, help should be readily available, and so instructions should be given to the helper to call 2222 for the paediatric resuscitation team, stating the exact location.
Paediatrics resuscitation team, ward 16, ground floor.
If the infant is not breathing normally, give 5 rescue breaths using a bag valve mask device with 15 litres of high flow oxygen attached, with an inspiration time of about 1 second, and ensure good chest movement. Check for signs of circulation or signs of life, taking no longer than 10 seconds. This includes purposeful movement, coughing or normal breathing. If trained to do so, check for a central pulse. In the infant, this is the brachial pulse. If there are no signs of circulation, start chest compressions. The landmark for chest compressions is 1 finger's breadth above the xiphisternum. For the infant, compress the chest to a depth of 4 centimetres at a rate of 100 to 120 compressions per minute. If you are the only responder, use the 2-finger technique. In hospital, when there is more than 1 responder, the encircling thumb technique is recommended, along with 2-person bag valve mask, if required. Continue CPR at a ratio of 15 compressions to 2 breaths. It is important to change the person doing chest compressions at least every 2 minutes to avoid fatigue. Having established effective CPR, the defibrillation pads should be attached to the infant in order to assess the rhythm. The paediatric ALS algorithm should then be followed as appropriate. It is important to remember your personal protective equipment. Follow the current local and Resuscitation Council UK guidelines for current PPE requirements for resuscitation attempts.